Let's start with, I guess, fear paralysis.
Okay.
So fear paralysis reflex, there's two ways that you could test, not on the table. So basically for observation, um,
Write this down.
when you testing or observing a child with fear paralysis reflex, we all have it where the biggest challenge for them is we're looking at the nervous system where they're in the freeze response or hypervigilance state. A lot of that you're gonna see with fear paralysis is the eye contact is really hard. Um, you would see kids like would go underneath the chair during the evaluation, just very hyper vigilant of their surroundings. Um, Maybe not respond to your request and let's say, hey, can you sit on the chair? They would not. They might not. They might just appear shut down already when those hyper vigilant mode is, our startle response is hyper activated, which is the fear paralysis. In terms of the test, it's really simple, where you gonna basically have the child supine or sitting. What you can do, of course, you can ask for permission. Where, hey, can I place my hands on your below your collarbone? And what you're gonna do is basically just a slow, gentle tap, eyes open, and then you're gonna see how they react. They you would see sometimes like a protective bracing. Sometimes you might see a moral response where their hands gonna be like this.
Mm.
So you're gonna look at like the response of the test where, oh, the Moro is influencing, or there's a proprioceptive response when you're doing fear paralysis. Um, so you will see that. And then there's a portion where you have a person, this is very vulnerable spot, especially when they're laying on their back, where, hey, can you close your eyes? And I'm just gonna place my hands here, and I'm just gonna do the same tap. And then you would see a lot of fluttering of the eyes. They kind of like very shaky, fluttery. This just tells you that their nervous system is basically, it looks overwhelmed, hyper. What's that word? Where you're anticipating the tap, like hyper anticipation
Mm.
of that.
Aware.
Yeah, and then sometimes they would do like a
Mm.
response to it, like a motor response, whether it's like that startle or core withdrawal. Also, when you're doing eyes open tap, you can also look at their eyes if it goes dilation.
Mm-hmm.
So that tells you that they're in the sympathetic mode where the pupils are dilated, so to speak. So that's pure paralysis. And for test for moral reflex, where, hey, can you lay down on your back? So let's say they lay down. If they couldn't lay down at all, that's just indicates that that is super ultra protective response. When they're from sit to supine is very difficult, very protective. This you'll sense that protective bracing for moral. So moral one, basically, when you see them lay down, and then the real test for moral is therapist would be on the head, and then you just basically tilt the head up. And this is so hard to test up first because head is the most protective area of our body, and doing this test can be very hard for some kids. So we don't push people's head like people do it online, where, hey, this is what more reflex. So we don't do that. So basically, just tuning in, and you just tilt their head. Of course, you can ask permission if you can touch their head, and sometimes you would see this response, or it just in general, if they lay down, they automatically do this. Their Moro is hyperactive.
Okay.
And then you might see kids that would, after this, they might be disoriented or whatever it looks like. They might go to fetal position too after for Moro, because that's that flexion and extension pattern with the. And then that's basically what Moro reflex is. And how for adults, like I feel like my Moro is a little bit activated because when I do here, I'm really a little bit shaky on my tummy. it's just, my Moro is just a little bit turned on a little bit. People think it's like muscle contraction and stuff like that, but just a lot of tension in your tongue just going up. It should be like so. That's basically the Moro reflex. And there's also tests on the feet where therapists would just gradually slide down their feet. It's a little bit more kind of like a pull on the feet where you might see this is like, let's say, hey, I'm gonna pull your leg, unexpected response of movement, and they're gonna go to like that more response. Oftentimes it's subtle where you might pull their legs where they don't have any response, but just looking at the hyper vigilance that they have and the startle response that they have. Before we move forward to the next reflex, I want to let you know that you don't have to let your dream trip for 2026 getting pushed back because flights feel too expensive. Recently, we went to Venice and our flights were covered using the points we built up with Capital One Venture. I also have a referral link, so if you've been thinking about traveling rewards, you can check it out. Just make sure it fits your budget and use your credit responsibly. For this travel, we use our points for hotels and flight. And the startle response that they have. Let's say after Moro, you might see a hyper reactive where the kids like couldn't already tolerate the testing that you're doing for the tests. So that's Moro and fear paralysis. It's called the Tonic Labyrinthine Reflex. Basically, reflexes a lot will have to do with our muscle tone and anti-gravity position. Because TLR reflex, it starts in utero. It has to do with the movement of the fetus in the utero. So it has to do with that reflex. But to test the reflex is super easy. Can they move their head up and down without any associated movement? So you might see kids when you do their test right away. It's like your head is going up, or like this is like, hey, can you lift up your head? Your head is gonna be like, that the arms are following. So that's a TLR response where the reflexes hasn't been integrated properly, or the connection of integration is poorly. And so basically just doing this, look down all the way to the flexion. Do you see any sway? You should be able to see kids that are able to have that sway, no sway at all. So able to ground themselves and just move up and down. But there's also tests where they do eyes closed. You might see some changes in muscle tone as well with this. So something to keep in mind. Doing eyes closed, neck movement. The test on many journal is the child pose for TLR. So I'm just gonna show that real quick. Some kids with birth trauma, this position is very difficult for them. So this called the child pose in yoga world, but this is also a reflex, the Tonic Labyrinthine Reflex, where the child pose looks like this, right? For some kids, this is very uncomfortable, especially if they have birth trauma. And a lot of kids, if they miss this type of movement in terms of their movement developmental hierarchy, this is very restorative pose. So if the response to this pose is hyperreactive, their nervous system is very very wacky. It shouldn't be. As you can see, you can put TLR on the baby's mom breast, right? TLR when you see baby where when they wake up in the morning, their butt is up in the air. So that's a reflex. It's a restorative reflex. So that's basically TLR. So testing that, there's some muscle response, but the way the way testing with TLR is really just can they do the pose first, um, and then what's the integrity of their muscle tone. You always look at muscle tone. If there's any concern with muscle tone, is there hyper or hypo? Because a lot of the TLR is related with hypertonicity or hypotonicity. So
Any of these? ATNR, STNR, automatic gait, leg cross flexion extension.
well, let's start with the NR reflex, which is the ATNR is asymmetrical tonic neck reflex, and then the STNR is the symmetrical tonic neck reflex. As you can see, and TLR, they're all related to each other, and the way really, and Moro as well. Moro reflexes in the neck proprioception. So all of our reflex start with our neck development and also brainstem. This is like the brainstem, the hindbrain, I think some people call it. Basically, that's our primitive brain where, the fight or flight brain, where survival mechanism brain develops. Basically, brainstem, or ATNR, you look at muscle tone. So you would see kids with retained ATNR, they have difficulty differentiating left and right. Their visual tracking skill can be off. Their coordination can be off. Cross-lateral movement can be very challenged with ATNR. They have, the crossing midline can be very difficult, coordination-wise. Riding a bike can be difficult for ATNR because the moment, so let's example with ATNR and function where you're riding a bike, then you turn this way. ATNR is like this movement, right? But there's, let's say you're still on it, but there's a change of muscle tone on your body, so you might destabilize your steering wheel for your bike. So a lot of kids that they're learning how to bike, they turn their head, they crash. So that's something that kids that can be difficult with the ATNR, because when you look at it, it's like there should be no significant change of muscle tone when they turn their head. And what other thing that you're gonna see with ATNR is the symmetry. So to check the symmetry, basically you're just gonna look at their symmetry of their legs. So I'm just gonna show you how to check the symmetry of their legs. So basically you ask them laying down, hey, can you lay down your head? So basically, how's my symmetry? You see my feet?
Oh,
Are they equal, or one is longer than the other?
They look equal to me.
So sometimes you would, hey, can you turn your head on the other side? Do you see any changes?
No.
Now, turn the other side. Any changes?
I don't think so. No.
So what you're gonna see if they turn their head this way, there's a little bit of shifting on the lengthening of the muscle. It relates to neck and head movement. So that would be looking at it functionally, where the ATNR are still not fully integrated. So next one is the STNR. So basically there's two poses that you can do. You can have the Sphinx pose, they call. So stand like a Sphinx. Can you move your head up and down? So if you see kids like have a hard time with it, let's say if they move their head and then they move, they have like extra movement either way. Sometimes they would the arms would slide. The more I see where there's a lot of challenge for kids, where when I'm testing STNR, it's like, can you move your head up? And then when you look down, they crash. And like that. And then sometimes if they move their head up, now my feet is up too. They should be able to do that. And what you're also looking as the integrity of the spine. So you should be able to see just normal arches. So if you look up, there should be a curvature on your spine that is very visually moving. And then you look down, it should be kind of like a camelback and sway. So some kids, it's like a brick. Like there's no movement of their spine at all. So that's STNR. So developmentally, it's a lot of part crawling, getting ready to crawl. A lot of kids would do this. When they're baby, you'll see baby doing this. That's just basically they're learning how to integrate all this developmental movement patterns that we have, because we need vestibular, which is closest to the brain stem. Your cerebellum is closest to your brain stem, so that's why they're doing some of that rocking to stimulate the vestibular function, which is the cerebellum. In many ways, it's also our ear, the inner ear. Landau is the Superman. They call it the Joy. This is like almost like everyday task that we always incorporate. So a lot of kids for Landau, it's just they see their postures always crash. There's no the trunk extension, the Superman pose. So it's super easy to test. Age appropriately, if they can do 30 seconds, whatever. I think it increased by age, whatever, but I forgot the age numbers. So, but basically have them do this and then hold it. So for whatever, how long they can hold it. But you want to see 30 seconds by like, I think 5 years old, they should be able to do 30 seconds of Superman pose. Reflex wise. And again, that helps us with our flow of cerebrospinal fluid between sacrum and the head, the brain, and the dura matter. Any questions with that? Landau.
No.
Leg cross extension. We kind of danced with leg cross extension yesterday, where you step on a sharp object. Ow!
Oh, yeah.
And then I need to get out from the danger. Now I'm safe. That's like cross extension.
Okay.
I'll send the feet reflex where all the feet reflexes are.
Okay.
The Babinski, foot grasp, foot tendon guard.
Okay.
So that would be very useful for you for visualize. And then also the hand grasp, the hand reflex. So those are like the big one. The automatic gait, basically it's a test where you can do it laying down, but can they do this? Like being midline, not so wonky.
Right.
My feel here is a little bit off because of the mat, which is adding more challenge in my stance. But can they do this without super? Yeah, not super move. We can just stand still. So what did this mean? So automatic gait when we walk, it's like this. Some kids you will still see walk hemilateral pattern. Kids with cerebral palsy, they might walk like this with the hemilateral, just one side first. Development where we wanna, just walking 20 minutes a day, they said they just reduce a lot of our problems in life. So just having that walk, right? So
what about the spinal gland and the spinal thoracic?
So spinal gland reflex, and that's basically where I'm just gonna show the muscle man here, and spinal gland is stroking the sacrospinalis, which is the side of the spine, and then you're just gonna do this. It's a quick stroke. You can use not pencil, but if you don't want to use your finger, you can use a tool to see that reflex. So what you can, baby should have it before within birth to 1 year. but you won't see decrease of hypersensitivity on that and less motor response. Where when you stroke it, and then let's say the kid is 3-year-old, that you shouldn't see the spinal column right away. So now what does that mean? Any tags in their clothing. Also, auditory processing from behind can be very challenging. They can be oversensitive with all those noises. Auditory processing is one of the challenge for spinal column reflex. Especially if you sit in the front of the classroom where a lot of chatter on behind you that you can hear. Just if you feel more wiggly, right? Like for some kids. So the spinal column, it's related a lot with other developmental hip and shoulder coordination as well. Because the movements basically understanding that movement. And for the spinal paralysis reflex, so basically stroking from bottom up. So from here, sacrum, all the way up. And you're just gonna do one stroke and see if they do a response where their body's gonna tilt, they would do a posterior tilt. Sometimes they would do that if it's hyper reactive. Sometimes they would do like the mermaid pose where they would kick their leg up. So those are.
You do it right along the spine, you said?
Along the spine. Those are along the spine. Yeah, the spinal paralysis.
There was the Babkin and Kodinsky, but you said you would send me some other stuff on
Yeah.
that.
So Babkin is our feeding survival mechanism. The moment the child was, out of the uterus after birthing, in order for us to suck, the mother's breast is basically the sensory input on the palm. So that's basically that allows us to grasp. So you have the hand grasp to able to latch on to the milk, basically our food, our survival. So Babkin put a lot of hyperactive Babkin is like a lot of chewing, a lot of biting their nails, a lot of that. Let's say they're writing, there's a lot of overflow in the mouth, touching their lips, tongue sticking out. You'll see that since you're working in school.
Yeah, like drooling.
Drooling. They're also related with the integrated of the oral facial integration with Babkin. And then they go hand in hand with rooting reflex. Basically, rooting reflex is just the side of the cheeks.
Yeah.
So you just test that and just swipe. You can use like those paintbrush to test those if it's hyperactive. Those are like hand in hand reactions there for those reflexes.